Planet Vero Studio is powered by the Nolan Group of eXp Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
Good afternoon, and welcome to Community Conversations, and welcome officially to summertime. We're so glad that we have extended daylight hours so that we can do all the wonderful things that we like to do in this community between the sun, the surf, the sand, and occasionally a cleanup or two. But certainly it gives us a better opportunity to visit with individuals, learn a little bit, and really relish the days of our lives. So to that end, today I have Carrie Lester Maynard, who is the Executive Director of the Substance Awareness Center. So welcome back, Carrie.
Hi, Vicki. Thanks for having me.
Well, we always have something great to talk about, and this is no different. The last time we talked, we were talking about what was going on at the Substance Awareness Center, but that's been many months. So do you want to start by giving us some updates of how things are going over there, what trends you might have seen as we started 22?
Sure, Vicki. Well, as you know, and as I've shared, our agency focuses on prevention works and recovery works. And so under prevention works, we do a lot of work in our community towards adolescents, protecting that vulnerable developing adolescent brain. And so right now we're geared up. We're out in summer camps providing our Botman Life Skills Training Program, which is a skills training program for all the kids in summer camps. And it's just a great universal approach to make sure our kids have some general social skills, interpersonal skills, and drug resistance skills. And then
some critical thinking skills, perhaps?
Yes. Decision making is one of the lessons that we teach. And then we'll be gearing up to be in the classrooms when school starts. We'll probably be in the classrooms starting in September, where we reach over 5,000 students with evidence-based prevention curriculum.
Is that primarily in middle school?
It is 6th, 7th, 8th, and we do some lessons in 9th grade. And so we are really happy to have that good public health measure for our community, for the kids in Indian River County.
That's wonderful work. And we've got to start them young.
Our coalition's been very busy mobilizing the community to address the landscape. We have stakeholders that come together to address alcohol use, marijuana use, and prescription drug abuse in our community. And so busy on the prevention side.
Yes. And certainly well needed insofar as all reports are that the pandemic has really affected a lot of us in a lot of different ways, whether you call it mental health, forgetting health, or using things that you probably shouldn't to forget that you're ignoring your health.
Yes, and on the recovery work side of things, we do provide treatment for adults with substance use and co-occurring disorders. And so we've certainly seen an increase in demand for services. We have a highly structured day treatment program, our outpatient program, and our recovery assistance program has been, maintaining capacity since probably the 2020, since 2022 has started.
And we share a lot of the same patients because we do the medical side of medication-assisted treatment, and you're doing both the prevention and the ongoing counseling and checking up on them as well with random drug screens.
Yes.
So it's a great collaboration. And yes, our volumes have been up since before 22 started.
Yeah. And, and speaking of volumes being up, I just think it's really important that, the community understand that the rates of substance abuse are up across the nation. They're up here locally. But last year, in 2021, over 100,000 Americans lost their life to an overdose.
Wow.
And so, if you just let that sink in a minute, that's about 275 people a day. So we think about, that's 1 or 2 commercial jetliners falling out of our sky every day. And so
we should be alarmed.
Is significant. We should be alarmed. And
yes, if that were happening around us, we would be going, oh my gosh, don't get on planes.
Yeah.
And yet we're not really sure how to cope with what's happening before our own eyes in our own community.
Yeah. And so, we don't know how to sound the alarm in every community, but we are out there. We certainly want to educate. We don't want to create panic, but we want people to understand what is happening with the opiate epidemic, what fentanyl is doing to fuel overdoses. And I can tell you, in Indian River County, we have seen an increase in responses to calls to EMS So I would say like back in 2019, it was around 200 overdose calls for the year to EMS. And in 2021, that was over 600 phone calls to EMS on overdoses. And so we're seeing 3 times as many calls that really impacts our systems, our first responders, our hospital system, and to ultimately our people with substance use disorders end up, flooding into our jails too.
Absolutely. And, the Pollyanna, the optimist, the glass half full piece of me says, well, part of that is because now our EMS folks can do something. They've got Narcan on board. They've been trained. People are making the calls because they know that there is something more that they can do. But it's really not the prevention side. It's the reactive side. And we are seeing the rates of utilization continue to go up, not just with opioid substitutes, but also alcohol. When we sit at home and we're bored, it's easy to lose track of how many times we pour over that alcohol, I suppose, whether it's boredom or distress or anxiety. The results are the same. The utilization is going up. But again, there are things that we can do. I want to keep this on a positive note.
Sometimes I'm doom and gloom with my data.
Exactly.
There is a lot we can do, and we certainly like to share the hope and beauty that recovery is possible. And there are evidence-based interventions that we can use for people who are abusing substances. And that abuse occurs on a continuum. And so the earlier we can intervene, the earlier we can recognize signs and symptoms and put interventions in place, we can change trajectories for people.
So as you talk about the earlier we can begin, we know that every high school, probably since alcohol was invented, had some times where kids would binge drink, okay? Whether it was back behind Grandpa's barn or in the suburban neighborhoods, that's almost like a rite of passage. But it continues on for some individuals, and the models that they get from their parents or grandparents certainly affect that. We've seen that in a number of cultural mores from pregnancy all the way through drinking. And so are you seeing that it's easier to help turn that around, as it were, in a younger age than it would have been, 10 years ago? Or are we still holding to that? You got to be 18 or 21 or whatever before we can really start intervening and making a difference.
Well, so our goal under Prevention Works is to really protect the vulnerable developing adolescent brain from the effects of substances. That the brain's not fully developed until the mid-20s. It's going to vary depending on each individual. But the developing brain is really vulnerable to the impacts of substances and really primes the brain for addiction later in life. So age of onset of any substance use, including alcohol, is highly correlated to developing a substance use disorder later in life. So substance use disorders truly are a disease of adolescence. They begin in adolescence. They are prevented in adolescence. And so even, you use that term rite of passage, and so many of us think of it as a rite of passage, but it's not a benign rite of passage, and it doesn't have to be a rite of passage. And so the more that we understand about brain development, the more that we understand about the impact of substances. If you delay the onset of use till after age 21, you significantly reduce the likelihood of ever developing a substance use disorder. And so we know that earlier onset is certainly what we're targeting. We want to protect that brain from those substances.
And it can be something as simple as starting to smoke, which again becomes an addiction that the brain responds to, and substituting the nicotine vaping doesn't really change that. In fact, in some cases, it makes it worse.
Correct. And really what we know about substance use disorders is it doesn't even matter the substance. They all impact the same part of the brain. So it's a brain disorder. The substances of abuse change the structure and function of the brain, and that's the reward pathway. So it doesn't matter which substance it is. Okay. And so you're priming that reward pathway, to pursue that substance at all costs for that reward.
So what advice will you give parents?
We give parents lots of advice and suggestions, and our coalition does a lot of work to educate parents And so there's a campaign, a national campaign that comes out of the Substance Abuse Mental Health Service Agency, and it's called Talk, They Hear You. And we really like that campaign because parents need to start that conversation early. And the campaign says as early as the age of 9.
Wow.
Talk, They Hear You gives parents the tools and a toolkit to start those conversations, have those conversations, and they don't have to be formal conversations. It's about how do you maintain conversation with your kids? How do you set clear standards and clear boundaries about expected behavior? We know that kids whose parents set clear boundaries and expectations, have a clear no message around substances, those kids drink less than their peers whose parents have more permissive attitudes. And so a lot of parents think they're doing the right thing. They allow drinking in the home because they feel like they can monitor and protect their kids. But the data shows very clearly that those kids drink even in greater quantity and frequency outside the home. And so that consistent, clear message is really important. Talking about the dangers is really important. Letting kids know where you stand on drinking or substance use is really important, particularly at a young age. And again, we just really want parents to understand the vulnerability of that brain to those substances. And that's why that delayed use is so important.
Well, and I'll be honest, I have been challenged. My 11, now 12-year-old son sees me have an occasional glass of wine with dinner. And so that has brought forth the conversation of, well, you drink, okay? And that makes a lot of parents very uncomfortable, okay? I said, yeah, and I also vote. And that's something you can't do yet either. There are certain things that happen at different ages in your life because you are now prepared and ready for that. And 12-year-old bodies are not ready for alcohol in them. You know, that may be a simplistic message. It may not even agree with the you talk, they listen. But that's one of the ways that we have uncomfortably at first addressed that as he gets a little bit older.
Yeah, and I would say really the differentiation between an adult brain and a child's brain is the important underlying message and key there. And so, we don't compare to adult behavior. Although we know binge drinking rates are high among the youth in Indian River County, our youth use actually substances at higher rates than their peers across the state of Florida. And we have very high binge drinking rates among our youth. But they also mirror the behaviors of the adults in our community. And Indian River County has high rates of adults who binge drink. About 1 in 5 is what the data shows.
Wow.
And the adults in Indian River County are binge drinking at rates higher than their peers across the state of Florida. And so some of it's role modeling behavior. Some of it is differentiating my one glass of wine on my fully developed brain is very different than exposing your brain to that glass of wine.
And, kids can't go out and buy the booze. So adults have got to have some interaction, some responsibility in this as well. So when we come back from our short station break, we're going to talk about how adults can transition into a better lifestyle, both for themselves, their kids, their grandchildren. Okay?
Great. Thank you.
The new year is underway, and it's time to schedule your annual physical. This quick, comprehensive visit can uncover diabetes, high blood pressure, and even cancer, ultimately saving your life. Treasure Coast Community Health waives Medicare deductibles and offers a sliding fee scale discount, so everyone can afford to take care of their health. We can't fix what we don't know. Let's work together to make a healthier community. Call us today at 772-257-TCCH. We're a nonprofit.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats, and chairs, including lots of slipcover styles from Universal, Four Seasons, and Capri. We also have a gallery of Tommy Bahama and Lexington furniture with styles designed for a relaxed approach to the finer things in life. Right now, we're having a summer sale with lots of great markdowns, including all pictures, lamps, and accessories half price. Sunshine Furniture, $12.95 US 1 in Vero Beach next to Planet Fitness. Family owned and operated since 1991. Don't forget to visit our outlet and closeout store directly across the street and visit our website at sunshinefurniturecasual.com.
Sunshine Furniture brightens up your day. Sunshine Furniture, the best in every way. Have a sunshine day. try.
You can trust Sandpiper Pest Control, serving Indian River, St. Lucie, and Brevard. Certified by the state of Florida to treat homes, lawns, and termites. Fully licensed and insured. Priced right, effective, and friendly.
Hi, this is Joel, the owner of Sandpiper Pest Control. Sandpiper can solve your pest issues. No contracts to sign, just results.
Call for a free estimate, 772-589-0204. Sandpiper Pest Control, a member of the iTex trading community. Your iTex dollars are welcome.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, and that program allows us to treat over 26,000 individuals within Indian River County. And we're so glad to have that privilege and honor to not only provide medical care, which used to be the definition of good health, but also pharmaceuticals that help you manage your lives daily, and the flip side, the not so good behavioral health medications or substance use disorder things that happen to us in our current environment, as well as dental and diabetes control and all kinds of other things, because we understand that it takes a head-to-toe approach, sometimes more in one than the other. But today I have Carrie Lester Maynard with me as a partner in crime, so to speak, to help make a healthier community. And unfortunately, substance use disorder is not a fave talk, as it were. We're both pretty positive people, but the reality is that substance use disorders can ruin lives and families. And so, again, in the interest of good health, we're approaching this topic to talk about what we've seen and what you all can do with our assistance to kind of make things better for you and your family, your grandchildren, your neighbors, because it's a ripple effect. It's not just like having diabetes and you can't have as much sugar as you'd like. It really, in mental health and substance use disorders, is a ripple effect.
You know, Vicki, I started the program with some of the startling statistics around the death and the doom and gloom. You know, but the reality is 1 in 7 Americans, and this is pre-COVID data, I hate to see what it is now, but 1 in 7 Americans will suffer with or struggle with a substance addiction in their lifetime. Yep. That's 1 in 7, and probably 1 in 3 will be directly impacted by someone's substance use disorder.
So when you go out the next time with friends, sit around the table and count off. There's somebody sitting there at your table that you're unaware of that's struggling.
That is struggling. And so I think what's really important is, how do we start to reduce that stigma? How do we help people see that there is hope and beauty in recovery, that people can and do recover, and that it really isn't about a character failing or a moral issue. It truly is a brain disorder and a brain disease, and that there are evidence-based interventions and solutions that help people achieve long-term recovery. And so, we look at it, we look at it as a medical disorder that is treatable. And, we look at it as a chronic disorder that needs continual treatment. And we don't look at failures of treatment, just how do we modify to help manage this disorder throughout the lifetime. But people can't put it in remission for their lifetime.
Absolutely. I have a relative, I will protect the innocent here, who started drinking early, drank through early parts of their marriage. Until their wife said, "We can't live like this. Our family can't live like this." And so whether you call it sober or clean or whatever the word of the day is, through support and through dedication, got into a program and has had 50 years that I've known this individual that's been much better for everyone. And so it is possible. AA is still a strong support system for those folks who struggle with alcohol use. But there are many other resources now in terms of group support that don't have to be related to AA, whether it's a church group, or I'm sure you're probably much more cognizant of those than I am.
Yeah, but you bring up a really important point, which is there's multiple pathways to recovery, and my pathway may not be the same as your pathway, and we have to honor and respect that there's multiple pathways, and
that there will be failures that are human. Okay, they're not on purpose. They're not done to hurt anyone. and just get back on the horse again, as they say.
We like to call them lapses.
Thank you.
But just like any other chronic disease, if your blood sugars go haywire, we don't call you a failure. We modify the medications or we modify the diet. If your cancer was in remission and it comes back, we don't call you a failure. We look back at, do we need to do more radiation or do some rounds of chemo? How are we going to do that? And so I think the more that we move substance use disorders into that medical model and treat them as that chronic disorder that they are, we can remove some of that stigma. And also the same way too is, you can be diagnosed with cancer and your doctor can outline a couple of different courses of treatment. You could have surgery. We could just try radiation. We might want a combination of radiation and chemotherapy. And so we need to do the same thing with substance use disorders. We need to outline the menu, the options, the pros and cons of different options, and so people can make informed decisions about what they feel is best for themselves and for their family.
And I take it that that's what your staff spends a lot of time doing.
Yes. And we also recognize that, treatment at our agency may not be the best fit for everybody. And so we make sure we have a staff of 3 trained peers right now. And here's another startling statistic. Only 10% of people with substance use disorders nationally ever access the specialty treatment that they need for that disorder. Oh. Only 10% of the people. So to me, that's an unacceptable data point. And so I have charged our peers with what we call assertive outreach. Really meeting people with substance use disorders where they're at out in the community to plant those seeds of hope and to remove barriers and obstacles. And one of those barriers or obstacles is sometimes you have to do it this way. Yeah. And so we educate about the multiple pathways. We let people know that there are detoxes, there are treatment centers. We can provide just recovery support if you're not ready to enter treatment. There are 12-step programs, there's church programming, there's support groups. And so it's really about meeting someone where they're at and where they're willing to make those changes. There's medication-assisted treatment. We call it MAT. And that there are FDA-approved medications that help stabilize the brain so people can fully engage in some of those other resources available in treatment and recovery.
That's where our original
partnership
started. And we continue to do that. We're going to revisit that opportunity at the jail because we know that many people that get incarcerated in the jail is because their brain wasn't functioning the way it should. And I would say 60 to 80% of the time it's because it's been influenced by a substance. At that moment in time, they were not thinking. Nobody wants to go to jail.
Yeah. When I was seeing clients and I would work with, clients in the criminal justice system, I would remind them that, people with substance use disorders often commit crimes. That doesn't mean that they're criminals. It means that, but they do have a substance use disorder that can be treated. And when we look at and understand substance use disorders as a brain disease, we understand that the person will pursue the drug, the reward of the drug at any cost, and it becomes biology, not choice, because we've hijacked the system, the reward center and the pleasure pathway in the brain. We can understand that. That doesn't make an excuse. It doesn't mean people don't have to be held accountable for their behavior, but we can look at them and treat them through a different lens when we understand that it was really the way the brain is now wired, not necessarily the person making those decisions.
As you've been talking, I've been thinking, I wonder how I could get this so it could go on instant replay many, many times, because those are the facts. And if we don't look at the facts, if we deal with people just with emotions, we're never going to break our history. Yeah. Okay. And it definitely needs to be first and foremost, how can we make things better? And you just gave us those pathways. So again, those of you that have been with us to the end, Carrie, give them your phone number and your website so that no matter when or how they reach out, they have that tool.
Yes, the Substance Awareness Center, 770-4811. You can reach us at sacirc.org.
And you can look at this Facebook page and pass it on to those folks that you think would benefit from it. So again, thank you for being with us, Carrie. Thank you for being with us on the radio, listening in. And again, have a really good evening.
Thanks, Vicki.
Mm-hmm.